Hello, everybody. My name's Dennis Buchholz. I'm a neuropsychologist in Louisville. I've spent my career evaluating people with different sorts of brain injuries, stroke, dementia, Parkinson's. And I did that for 40 years in private practice. I was affiliated with the University of Louisville School of Medicine, so a lot of patients for them. The last few years, I saw quite a few NFL football players in the head injury litigation going on, which is still going on. But I eventually retired and got affiliated with Oasis T.M.S. And that's what has precipitated this talk. So I work for them now. Oasis is a private TMS clinic in Louisville. They also have branches in other locations like Indianapolis and Lexington, and Elizabethtown. But there are many other people opening TMS clinics around that are perfectly good, perfectly reputable. There are several in Louisville other than Oasis. And presumably they do things slightly different. I'm really not informed about how different clinics do things. But this is about how we do it at Oasis, which is, as far as I know, pretty standard in the industry as it is. It's developing more and more as a separate treatment option rather than going through traditional psychotherapy, traditional psychiatric treatment as we've known it traditionally. Ashley Wolf and Danny Lutsky are two people in the office with me who assisted in preparing this talk. So this is a very basic talk. This is like TMS 101. It's not designed for people that are already experienced in TMS. What I found is that very few people know about it. I've been surprised talking to psychology graduate students or psychology postdoctoral students who don't know what it is, who haven't heard of it. So it's something that people don't know about. So I'm starting this with the assumption that nobody in my audience knows anything about it. So don't be offended if I'm talking at too basic a level for you. These are the bullet points for the talk. What is TMS? How does it work? What are the devices that are used? What are the adverse effects? A little bit of research, and I have a patient testimonial about it. Of course, TMS is transcranial magnetic stimulation, and it's primarily used for depression, the treatment of depression, although there are many different protocols for different psychiatric conditions. OCD, anxiety, there's one for tinnitus now, obsessive compulsive disorder. There are many different protocols. One of the things that I hope you'll remember after this is that insurance covers this. TMS has been around for decades, and there's thousands of articles that have been, research articles that have been done, but people haven't heard of it, I think, in large part because it hasn't been covered by insurance, but it is now. And that's why our clinic is able to function, because almost all the people we see are on commercial insurance or Medicare, and it's paying for that. And so the cost is pretty minimal if people have insurance. So a typical copay is $25 to $35 for per session for the treatment. Which and of course, if you're at the end of your year with your plan towards December, it will be covered 100% in many cases if your deductibles are all met and so on. So the first TMS device was developed in the 1980s, and I think near as I can tell, the effectiveness for depression was really a serendipitous finding in conjunction with research for other purposes. What happens in TMS is an electromagnet is placed next to your head, next to the client's head, and it is turned on, and that generates an electric or magnetic field that penetrates the skull and depolarizes neurons. In the case of depression, we're looking at the dorsolateral frontal cortex. And every time that the magnet is activated, it produces a pulse that stimulates brain tissue. Now, you could do this with direct electrical stimulation and hook a wire up to your head, but the voltage needed to produce similar effects in the brain is sufficient to cause significant damage to the head. And that's not a very desirable solution. You could also do this using cortical electrodes. If you drilled a hole in the skull and put an electrode in the brain, that would produce a similar effect. But the beauty of this is that it's non-invasive, and you can produce brain stimulation in many different areas of the brain without any kind of invasive procedure. So in the case of depression, we're stimulating brain cells in the dorsolateral frontal cortex on the left, and that produces results elsewhere in the brain. So these neurons lead to other locations in the brain. I don't think it's known exactly where, so we don't know exactly what areas of the brain cause the remission in depression, but it works. It clearly works, and so that's the justification for it getting FDA approval. And it produces changes in the brain that are, if not permanent, long-standing. So we can talk a bit about how many people go into remission and how long the remission lasts, and what kind of follow-up treatment is needed as we go along here. So I want to try to explain what happens when a patient gets referred and what experience a client goes through after they get referred to the clinic. For one thing, you don't need a physician's referral to send somebody for treatment, as you do for many other things. We have a psychiatrist in the office who does all the intakes and interviews everyone to see if they're appropriate for this kind of treatment, and not everybody is. We get referrals from physicians that aren't always appropriate as well. So the psychiatrist takes a history and makes a decision about whether or not the person is appropriate for treatment. We also do all the insurance work. So the patient can call in and give their insurance information, and they can find out before they come in whether their insurance is going to cover it or not. And you don't have to do that as a referring person. We take care of that in our office. And we can tell the patient exactly what it's going to cost in advance. So if an individual comes in and they decide they want to go ahead with the treatment, they'll come in for a mapping session. The mapping session takes place in one of these machines. These are the different types of machines that are available now. Basically, you have a recliner chair and a device that will generate the electrical impulses, magnetic impulses. We use the MagVenture chair. The one you hear the most about is the Neurokinetics or NeuroStar chair, which is the first one up in the upper left. We prefer the MagVenture chair for a number of reasons. It seemed like there was more research done with that, but NeuroStar is by far the one that has the best advertising campaign if you look on the internet or elsewhere. And it's pretty easy to find the nearest location to you by a little Google search. So in the mapping session, the client comes in, sits in the chair, and the magnet is placed pressing against their head. At this point, the client will have a skull cap on, a white cotton cloth hat, a tight-fitting hat that allows the administrator to mark on the cap for the correct location. And then for every time the patient returns, they put the cap on, and again, you can correctly locate the same spot every time. If you're getting radiation treatment, they give you a tattoo, but we don't do that. So in the mapping session, the person has their skull cap on, they have the magnet pressed against their head. It's just lightly touching the head. There's no significant contact involved. And one single magnetic pulse is provided. And the goal is to produce slight movement in the individual's right index finger, just a little twitch in the index finger, which means that they're correctly located in the motor strip anterior to the central sulcus. And that gives a reference point, and they measure 5 centimeters anterior to that and mark it on the skull cap. And that's the area that we stimulate repeatedly for treatment of depression. In other psychiatric conditions, OCD, anxiety, we look for other locations in the brain to locate the magnet and use that for stimulation. So in the mapping session, the person just gets an individual pulse designed to produce slight movement, and it also allows us to calibrate the intensity for that individual person, what an appropriate intensity of the stimulus is. After that session, either the same day or on another day, they'll come back for a regular treatment session. You go and sit in the chair again, you get your little hat on, you get the magnet placed against your head, but instead of just single pulses, or repetitive pulses are applied. And in an individual session, it takes 18.5 minutes. There are 3,000 pulses administered in 18.5 minutes. I've got my little metronome out here to try to simulate what it's like, because you don't feel anything. You might feel a slight twitching in your hair, but there's no other sensation associated with it. But you do hear this tapping noise, which is the sound of the machine producing the magnetic pulses. And the way it goes is you get 4 seconds of pulses and then 11 seconds of rest. So, and you get 10 seconds. 10 seconds. And that's the whole thing. So you get it for 18.5 minutes. There are 36 treatments in a session, not in a session, in a treatment period. So it's 9 weeks, every day, 5 days a week, every day. The last 3 weeks are tapered. So week 7 is only 3 treatments, week 8 is 2 treatments, and week 9 is 1 treatment. So it tapers down. And the first time people hear this, they say, this is ridiculous. It's a huge commitment to do this. But if people are really depressed, they're willing to commit to this. And committing to it is part of the treatment. You get people that are really motivated to participate in the treatment. And there's some advantages to that. Just having a person, you have a severely depressed person, getting them to get out of bed and come to the office every day is an important thing. It gives them a reason to get out of bed. The people in the office are very friendly, and it's, they're pleasant to talk to, and it's a nice activity. There are people that come back to visit us just because they want to talk to the people in the office. So that's an aspect of the treatment that isn't directly related to magnetic stimulation. So what happens? You go through these daily sessions, and after some number of sessions, it differs quite a bit from person to person. Some people say they start experiencing something after 2 or 3 sessions. The average reported in the literature by the industry is 3 weeks, that people start showing improvement after 3 weeks. But many people show improvement before that. And some people are late responders. They might not respond until the last week of treatment, but those are rare. In our experience, it's more common to see some change in functioning after a week or 2. And the interesting thing about that is that usually the client is saying, I don't think this is working. We should reconsider it. And then you ask them, well, what did you do over the weekend? Well, I cleaned out the garage, which I haven't done in 6 years. Or, my wife says I'm talking more. Or my wife says I'm telling jokes. My wife says I'm more outgoing. Other people are seeing the changes in the behavior that the client isn't really aware of. And that improves over time. And what has me really enthusiastic about this is that the result, the overall result after treatment, when it's effective, of course, it doesn't work for everybody, but we have a 70 to 80% success rate, either remission or substantial reduction in symptoms. There's a 40% remission rate and somewhat, or 70 to 80, rate of improvement, 70 or 80% improvement. The result is you get a normal person. Many patients complain about medications having negative effects on their emotional life, their emotional experience. So yeah, it helps with depression. They don't want to kill themselves, but on the other hand, they can't feel any positive emotions either. Many times I've heard people complain, that makes me feel like a zombie. Well, that's true. The medications, in addition to other physical side effects, have negative effects on your positive emotions as well. So you experience a narrowing of your emotional experience. You can't feel extremely happy. You can't feel extremely sad. You go to the funeral and you don't really understand why people are as upset as they are. But with this treatment, you don't get that kind of narrowing of emotional experience. People are able to have a more full range of emotion in addition to not being depressed. And so clearly, in my experience, that all treatments for depression are not created equal or don't produce the same result. And of course, some people need to be on medications. Some people will have to be on medications their whole life. But for many people, this form of treatment, I think, produces a more satisfactory result in terms of alleviating the depressive symptoms. What else? Side effects. There are no side effects. I so much want to say that there's no side effects to this, but in the literature, it's reported very minor things like irritation of the skin where you put the magnet, headache, referred pain, insomnia, anxiety. I've never seen any of those symptoms in clients we've treated. It's conceivable that they could get those. But unlike medications, which have substantial physical and psychological side effects, this has no significant side effects. Now, of course, some people, you wouldn't want to do this, or you would want careful medical monitoring of somebody with a seizure disorder before you put them through this treatment. Or if somebody that was psychiatrically unstable, someone in a manic phase would not be a good candidate for this. Obviously, somebody with a metal plate in their head wouldn't be a good candidate for this. This is a very powerful magnet that's used. And you wouldn't want to take your Patek Philippe watch in the same room with this thing. If you have an expensive watch, leave it outside. But other than that, there are really no side effects or contraindications. There is you heard. I gather you heard my metronome making the sound. It's loud, and we give people earplugs for every session if they want them. Some people don't want them anyway, but it's right on the borderline of potentially causing some nerve damage to your hearing. But I haven't we haven't encountered anybody complaining about problems with that. In any case, they're given earplugs for each session for that protection. So the current status with the insurance companies is that they typically require 2 failed antidepressant treatments before they will pay for TMS. But just recently, TMS has been approved by the FDA for first-line treatment. And I think this is the wave of the future. I'm very enthusiastic about this form of treatment because of the results it gets. And I think there are many patients who would not be willing to take medications or who won't go to see a psychiatrist, who would be able to cooperate with this kind of treatment because there's no indication that we're telling them they're crazy. It's more of a medical treatment. You go in, you sit in a chair, you have something put on your head, and you don't have to do anything. You don't have to talk about your life story or talk about what traumas you experienced as a child. We do encourage people to talk to during the session. The literature shows that the more active the person is, mentally active during the session, the more effective it is. But it isn't essential. So I think that there is certainly a group of patients who would not normally go for treatment of depression who would be willing to accept this because it is not obviously psychiatric. It's more like going to the dentist's office. I guess I try to avoid using that because people have bad associations with going to the dentist, but it's less painful than going to the dentist. But anyway, so the insurance companies typically require 2 failed antidepressants, which is not really a very high bar, really. Many people being treated for depression have been on more than that before they get to the TMS clinic. It's still nice to have this as an option, though. If you have people that have treatment-resistant depression and have been through everything they can think of, this is a good option. It's an additional option that is now available and insurance now pays for. So as I said, with the majority of people that we see are treated for depression. We treat people with anxiety as their primary presenting problem, but it's a different protocol. Instead of getting 18-minute treatments, the treatment for anxiety is with a different location of the magnet, and the treatment is only 36 seconds long, but the pulses are crammed into a very short period of time. It's called a theta burst. And it works. There are treatment plans for migraine. There are treatment plans for substance abuse, cocaine addiction. So here is our patient. Rhonda, are you there?
I am here. I'm going to pull up your video real quick.
We're ready for the video, please. What's going to happen? Do I stop sharing?
Yep, I'm going to need you to stop sharing and then I will start share.
Okay, I stopped.
Thank you, sir. Make this video really big for everybody. Actually, I don't think I selected proper thing. Let me try one more time. guys. There we go. Yep, I did select it. Can everyone see?
I can see.
And here we go.
Hi, my name is Andrea, and I wanted to share my experience with you at TMS Louisville. Prior to deciding starting treatment, I was disengaged in life, unmotivated, and very anxious. I was mentally and physically exhausted, and I was stuck. After my initial consultation with Dr. Parsons, I felt hope for the first time in a very long time. I just felt like TMS treatment could be the treatment for me to help me get unstuck. So during my sessions, I noticed my energy levels increasing. I did have motivation for the first time in a long time. My anxiety calmed way down, and I was thinking clearly. And the biggest thing is I was just responding to life on my terms and the way I wanted to respond versus how the depression and anxiety had told me to respond, because life was still life. It was not perfect before treatment, during treatment, after treatment. It was just the way I was responding was a lot more healthy and in line with who I am. Then as we went through treatment, we started to taper toward the end. And I did notice some regression. It's not as negative as it sounds. My thinking started to slow down. It's harder to make decisions. But I will say it wasn't at like pre-treatment levels. I had just noticed the mild difference between treatment where you go every day versus the tapering. And while I'll say I'm not 100% cured, I do feel unstuck, and that is a miracle in and of itself. And, you know, you may be watching this testimonial wondering if treatment's right for you, whether you should make the, you know, financial investment, the investment of time. And while I can't make that decision for you, I hope that my testimony helps make the decision-making process for you easier. And what I can say is if you do choose TMS Louisville, you will be in good hands at this practice because they care about their patients and they want to see their patients succeed.
Okay. Are we
And
back?
it's your turn.
Okay. So I'm back. I have control. Oh, I have control again. Okay.
Yep. And just click that green share screen button again and pull your PowerPoint back up.
Okay. Got it.
Good job.
So that concludes my presentation. I'm accustomed to having many questions. So if you
have a couple in the chat already.
Okay, I'm delighted to answer questions.
The first question says, is TMS being used for other mental illness such as bipolar or schizophrenia? If not, is there any research in using it in these illnesses?
Yes, there are protocols for OCD. It's an 8-minute session in the supplementary motor area. It's not approved by insurance. In fact, most of the other conditions that are subject to being treated are not covered. Right now, it's depression and anxiety and tinnitus. Oddly, well, no, tinnitus is FDA approved, but not approved by insurance. That's the next step. I'm sure there's some research going on with schizophrenia, but that is not at the top of the list of things that would be treatable with TMS. I think there's research going on with virtually any psychiatric condition you can think of. Yeah, I hope that answers the question.
You have another question. It says, do patients experience forgetfulness or memory problems? Is it similar to ECT?
Good question. This has nothing to do with ECT. In my mind, they're so separate, I don't even think about it, but I can see how people would wonder if this was like ECT. You know, when you get ECT, you get a massive shock to the brain, which induces a brain seizure in all or part of the brain. That's not what's happening here. Here you're getting a tiny little stimulus to a tiny part of the brain. And there's debate about whether ECT causes memory loss, but virtually every client I've seen with it has complained of memory loss. I certainly believe that there's memory loss associated with ECT. There's nothing like that associated with this, with TMS treatment. I'm glad you asked.
The next question says, have you had many patients who are minorities? Sometimes treatments aren't as effective.
I'm not, we've had some, I don't know that there's literature on any kind of racial, cultural differences as far as TMS would go. You wouldn't obviously think so. Think that there would be a difference, but it's theoretically possible. I don't know of any literature dealing with that specific question. It's an interesting question, but don't know.
Did that answer the question? You can just put it in chat. The next question is TMS offered at U of L Psych?
They have a machine that they've had for quite a long time. They have a NeuroStar machine. But they've had problems finding staff. They've got this expensive machine, but they haven't had the money to pay somebody to run it, that, you know, a technician. And I'm no longer connected with them, so I don't know what the status of it is now, whether they're actively giving treatments or not, but they have the potential to do that. So you'd have to call them up and ask them, you know, if they're offering it now. They do have a machine and the capability to do it.
The next question is, what is the cost without insurance?
Well, that's negotiated with the owner of the clinic. I'm not the owner of the clinic. So when somebody wants to pay cash for the whole thing, that is possible. I don't actually know the amount, on the order of $10,000. But because it's negotiated, you never really know actually what people pay. So it's easy enough to call up and ask. That would be the financial person in the office. They would do that. I mean, some of the clinics in town don't take insurance and only take cash, and it's $10,000. But we're primarily based on insurance and helping people get their insurance.
The next question is, of the 3-week time period where you see results, how many sessions are in that 3 weeks?
Well, it's 5 days a week. You get one session per day, which sounds, it sounds bad, but it's not. You know, people come to work at 8:30 or come to the office at 8:30. By 9 o'clock, they're done and go to work. And it works out surprisingly well. It's not a big time commitment. So that would be 15 sessions. Or typically somebody would be showing significant changes by 15 sessions.
Next one is what age range? Pretty much how young and how old? do
Well,
you treat?
insurance won't pay for less than age 18. So we have seen some people younger than age 18, teenagers, private pay. But in general, it's anybody over 18, from 18 to 90.
The next one, you mentioned that you treat football players. What about scar tissue?
Well, I haven't treated people with TMS, football players for TMS. I evaluated them as part of the litigation lawsuit in my prior life as a neuropsychologist. I'm not doing any more assessments now, so I'm not seeing any of those. Certainly, it's a valid question if somebody has a brain injury and has scar tissue. That would certainly be something you'd want to discuss with a appropriate medical profession, a neurologist, about before undertaking the TMS treatment. I wouldn't think there would be a contraindication unless there was an increased risk for seizures, but I'm not officially qualified to make that judgment. I would ask my physician about that. Everybody's different, both in terms of their presenting condition, their susceptibility to treatment, how long it takes them to respond, how persistent the results are. Some people get one series of treatments and they're done. Some people want to come back for follow-up sessions, like once a week or twice a month at their own discretion. We've had good luck with insurance paying for that. Some people come back after 6 months, they come back for a second round of a full round of sessions because they think that would be the best thing for them. So there's a lot of individual variability in that aspect of it.
I have another question. Do you offer a brain scan to see if it isn't working?
No, this is a functional measure. Sometimes we see people that have previously had MRIs, and we can use that in a different technique to localize where we do the stimulation. But there's not going to be any radiological evidence of change based on the TMS treatment or any other treatment for depression that I'm aware of. I suppose you could do functional MRI studies.
They added a caveat to it and said, what about SPECT scan?
The answer is the same. We don't rely on a radiological study. What we look for is behavior change. Now, hopefully, presumably there is some change in the brain. Measuring that is difficult. I mean, it's conceivable you could do it with a SPECT scan or fMRI, but that's not at all a routine part of treatment. We're looking for improved behavior.
One more question. How does this procedure affect the blood-brain barrier?
As far as I know, there's no effect on it. Google that and let me know what you find out. I've not heard of any problems of that sort.
And I think this last question is similar to another question that was asked earlier. It says, how have you seen TMS work differently in different races? I think that's similar to the other question.
I have seen no difference in my limited experience, but that doesn't constitute a scientific study. I don't know what else to say about that. We haven't treated anyone any differently. So that's all I can say about it, I guess.
And one more.
Interesting question. I mean, it's a kind of treatment that isn't dependent on interpersonal interaction, as you would in psychotherapy, where any kind of visible differences in people's appearance would affect the person treating. You know, the TMS machine can't tell what race you are, or how smart you are, or anything. So that's a positive thing about it, I think, too. Any more?
And treatment for PTSD with TMS.
Well, the VA is doing that. They contract with us to treat people. It's generally in people that have a dual diagnosis of depression and PTSD, and they're ostensibly treated for depression, but PTSD gets treated along with that. Again, we're somewhat at the mercy of the insurance aspect of the thing. But I don't know about specific statistical results of effectiveness of it for that. I'm sure there's going to be much more about this and much more about TMS and treatment of all psychiatric conditions, and first line treatment for depression as well. I hope this has been helpful. There on the screen are my contact information and the contact information for our office. I'm obviously very enthusiastic about Oasis TMS. There are other perfectly competent practitioners in the area. I'm not sure where the participants live, but it's pretty easy to Google TMS and find a provider relatively close to your wherever you might be. Don't hesitate to email me if you have more questions. I'll be glad to talk about it. I'm pretty enthusiastic about this treatment, particularly because of the positive results that I think are better than you get with other kinds of treatment. Of course, it does. It's not going to work for everybody. It's not going to cure somebody's marriage or their problem with their boss, but it can deal with the physiological aspects of depression, particularly a familial genetic sort of depression, which is often combined with life stressors and other aspects contributing to depression. Thank you.
Thank you, Dennis. I think that was an awesome presentation and I enjoyed it.
Well, thank you.
Oh, you got 4 thumbs up from Brenda and Jim.
Boy.
1
Absolutely.
thumb up from Mary.
Thank you.
Several thank yous in the chat.
Oh, wow. Great.
I had heard about it, but I'd never had it explained. And we were actually just talking about it. I'm from Kentucky, but I now live in Cincinnati. And so we were just talking about this on Thursday. And I was like, well, I'll come back on next Thursday and be able to tell you guys what I learned from the Kentucky conference. So thank you.
I'm sure there's a practitioner in Cincinnati. I don't know who they are, but a city of that size at this time is going to have somebody or more, doing it.
They have
Yeah.
a research hospital up there, so they better be on that.
Yeah. So I appreciate it. So thank you so much. This was outstanding.
Good. Good.
Are you located at the Dutchman's
Yeah, Dutchman,
office?
that's the Dutchman's.
That's where I saw the sign on
Yeah.
the third
Oh, yeah.
floor
Yeah.
or second floor? It's
It's
second floor.
first floor. It's first floor.
First floor? Okay. I saw signs, I think, on the second floor. It was like a vinyl sign.
It was on the second floor, but now we've
You
upgraded.
moved, that's
first
why the
floor.
signs
Moving
disappeared.
on down, yes.
So I've seen your signs forever and now I get to meet you.
Well, nice to meet you.
Nice to be met.
Okay, I'm signing off. Email me if any questions persist.
Thank you, Dennis. Thank you,
Bye-bye.
everyone.